Good morning. Thank you for attending. Today I'm joined by Louise Gagné, Executive Director of Community Services, to give an update on our work with schools, and Andrea, McLellan, Director of COVID-19 Immunization Strategy, who will provide an update on our vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the Health Unit resides in land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe people. This land is also part of the unceded territory of the Algonquin Nation. I'd also like to acknowledge the Métis historical presence in the region. So let's continue to educate ourselves to help the decolonization and reconciliation process. Yesterday, the province announced they will be introducing a vaccine certificate system effective September 22nd. Ontarians will need to be fully vaccinated, 2 doses plus 14 days, and provide their proof of vaccination along with photo ID to access certain public settings and facilities. This approach focuses on higher risk indoor public settings where face coverings cannot always be worn. These requirements will not apply to settings where people receive medical care, food from grocery stores, medical supplies, and the like. Aligned with public health measures currently in place, indoor masking policies will continue to remain in place. I'm supportive of the province in coming forward with this decision. At this time, I don't have any additional information on the plan for vaccine certificates, but we will be communicating as we learn more. Many businesses and organizations have already begun developing and implementing COVID-19 vaccine policies. And it's great to see everyone doing their part to control the fourth wave. With these vaccine policies, at a minimum, rapid antigen screening tests are required for those who are not yet vaccinated. But businesses or organizations may put in place more strict policies to protect their staff and their clients. It is important to note that the rapid antigen screening tests are only to be used when people are asymptomatic, meaning they do not have symptoms of COVID-19. The tests are not to be used to determine if someone with symptoms has COVID-19. Individuals who test positive as a part of their rapid antigen screening will then have to book an appointment at a COVID-19 assessment center to have a PCR test confirm the result. And with that, I'll pass it over to Ms. Gagné.
Thank you, Dr. Chirico. In the last 7 days, we had 15 new cases, bringing our total case count to 684, with 489 in the Nipissing district and 195 in the district of Parry Sound. The health unit currently has 13 active cases. There are currently no active cases that have tested positive for a VOC. Some new cases, though, are still awaiting further testing. We also have no individuals in hospital due to COVID-19. Over the past 14 days, 94% of individuals eligible for the vaccine who tested positive for COVID-19 were not fully immunized. A further 6 cases were under the age of 12 and not yet able to be vaccinated. With respect to schools, we are continuing to work with school boards as they develop their COVID-19 policies and procedures to align with ministry guidance and to minimize risk of COVID-19 transmission within the school setting. In preparing for next Tuesday, the first day of school, we encourage parents and guardians to look at Ontario's updated school screening tool. The screening tool has changed, so do not rely on the screening tool you used last school year, or even one that you may have used over the summer for camp. The up-to-date screening form is available online at ontario.ca/school screening. We also encourage parents to remind their children of COVID-19 etiquette, which may be forgotten in the excitement of returning to school and seeing friends and teachers. Students are to continue to practice physical distancing, washing hands frequently, wearing a mask indoors, as well as sneezing into their sleeves. Just as we have been supporting the school boards, the health unit is also available to support students, parents, and guardians with returning to school. in particular with understanding COVID-19 symptoms, screening, testing, and self-isolation requirements, along with other public health measures. On our website, we have resources for parents and guardians under myhealthunit.ca, COVID-19, schools and childcare. Or for those individuals who prefer to have questions answered over the phone, our Health Unit call centre is also in operation Monday to Friday, 8:30 a.m. to 4:30 p.m. at 1-844-478-1400. Lastly, follow us on Facebook if you don't already to receive COVID-19 updates, information for a healthy return to school, and much more. With that, I'll pass it back to Dr. Chirico.
Thank you, Ms. Gagné. And now I'll hear from Ms. McLellan to give us an update on our immunization program.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we are now at 81.2% of residents 12 years of age and older who have received at least one dose of a COVID-19 vaccine, and 74.35% of residents 12 years of age and older who are fully vaccinated. Additionally, 72% of youth aged 12 to 17 have received at least one dose of COVID vaccine, and 58% have received both doses. As of yesterday at 3 p.m., a total of 176,909 vaccinations have been provided within our district. On Tuesday, our mobile vaccine clinic hit the road for the first time. Our first clinic was held outside of the Case Alliance in Sturgeon Falls on King Street, and a total of 67 people received their vaccines at that clinic. 34 were first-time doses and 33 were second doses. I encourage workplaces, community organizations, places of worship, and other organizations or groups that can to request a COVID-19 vaccine clinic through our mobile clinic request form located on our website. The form allows eligible groups to submit a request for a mobile vaccination team to come to their site and provide first and second doses of COVID vaccine. To be eligible, groups must have at least 50 members and have a collective interest in receiving vaccinations on site. School clinics for age 12 to 17 will be held throughout our district beginning the week of September 13th. Information packages are being emailed to eligible families by the school boards. And we are currently working with our long-term care homes, high-risk retirement homes, and First Nation communities with elder care lodges to coordinate the administration of third doses for residents that were as recently announced. And with that, I'll hand it back over to Dr. Chirico.
Thank you, Andrea. So that ends our remarks, and we'll begin taking questions, try to answer as many as we can. If we don't have the answers, we'll certainly try to get back to you with the answers, and you can put your questions in the left of the box, and I'll turn it over to Alex.
Thank you. Our first question is for Dr. Chirico. It comes from Richard Kaufman at Moose FM. Is there concern about the latest modeling that was issued yesterday by the Science Table and the return of in-person learning at school?
Yeah, thank you for that, Richard. It's an excellent question, and it's one that we certainly are concerned about. And with the modeling projections that the fourth wave will see an increased number of cases, it really underscores the importance of being vaccinated. And the more that we can get people vaccinated and keep community spread low, the less risk it is to those who are unable to get vaccinated, and school kids being that population we're certainly concerned about. And that I think we also have to balance that with the importance of in-person learning. And we've identified that many times in the past as the social, mental, and physical importance of in-person learning. So we do know that the vaccines are very effective in preventing serious illness, hospital admissions, ICU admissions, and deaths. So certainly there is a potential for increasing pressures on our healthcare system. But the more things that are in place, all of the efforts we put in place to get people immunized, to make it accessible for them. There's plenty of opportunity to continue to access the vaccinations. And we also certainly know that by working with the school boards, and in the past, we did not have any outbreaks. We monitored it very closely, and we were able to reduce the risk with everybody working together. And we're going to do the same in the fall. And if things change, we may have to put in measures or change things depending on how the pandemic evolves.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Stu from Bay Today. Does our health unit have leeway to tighten or loosen vaccination certificate requirements according to local needs? Is there some flexibility?
There's always some flexibility to, depending on your local situation, to increase requirements. We can't lessen them. And it would have to be done in consultation with the Office of the Chief Medical Officer of Health.
Thank you. Our next question is for Andrea. It comes from Michael Lee from the North Bay Nugget. As of yesterday, nearly 7% of eligible residents, or 7,955 people, still only have one dose of a COVID-19 vaccine. How many of these people are residents who have recently gotten a vaccine and are waiting for their second, or people who have delayed getting their second dose for whatever reason?
Great question, Michael. I honestly can't provide you with a number answer with respect to that. I can tell you we are starting to see an increase in the number of people presenting at our clinics for a first dose in comparison to what we had been seeing. And in speaking with some of the individuals who do come to our clinics, some of them have definitely delayed their second dose. We heard that throughout the summer, when we saw a decline in the number of individuals attending our clinics, that they were waiting for the fall and the end of summer and vacations to be able to get their second dose. So we are seeing that happening at our clinics for sure.
Thank you. Our next question is also from Andrea. It comes from Richard Kaufman at USFM. Even though it's early days with the new mobile clinic, the bus, has there been a lot of interest from groups with 50 or more people to come to their workplace or organization?
We've had some requests for clinics within organizations, I think a total of 8, not all specifically for the bus, but we are looking at how we can use the bus to accommodate some of those requests that we have. And we've been working on a schedule. We have a number of locations scheduled over the next few days, and then we will continue to roll out the bus across our district.
Thank you. Our next question is for Dr. Chirico. It comes from Brad Obey from Vista Radio. As our country's western provinces face a surge of COVID-19 cases, and with high cases of Delta variant taking in many states south of the border, do you believe the vaccine passport certificate will help us quell the fourth wave in Ontario and here at home?
That's an excellent question. And certainly we are seeing in other jurisdictions, as well as slowly increases in Ontario, the fourth wave and the Delta variant. I think that the vaccine certificate is an added step in the whole strategy to keep the numbers low and reduce the spread of the virus. Is it going to be the only one? No. But if we adhere to public health measures, if we really see an increase in people getting vaccinated, and if this certificate is an incentive, as been seen in other jurisdictions, to get vaccinated, then it will be very, very helpful. So it's one part of the puzzle to really work together to slow the spread of the virus and reduce the risk to people and to overwhelming the healthcare system as well.
Thank you. Our next question is also for you, Dr. Chirico. It comes from Jamie from CTV News. For Dr. Chirico, based off information from the Ontario Science Advisory Table, what specifically worries you about the fourth wave?
I think that the main thing that worries me about the fourth wave is the potential for those that are unvaccinated to become really, really ill and die from it. We know that currently in Ontario, the ones that we're seeing ending up being admitted to hospital, ending up in the ICU and on ventilators, are the vast majority are the unvaccinated. And I think that is what really worries me the most, because when that happens, there is, and the science table certainly talked about it, is that it has the potential to significantly impact the healthcare system. And when that happens, there's lots of secondary effects from that, where normal healthcare isn't at the same level. So for people that need investigations or cancer treatment or surgeries, that, as we saw before and earlier in the pandemic, that all gets delayed and there becomes a really huge backlog. So I think that's what concerns me the most when that happens. We want to keep schools open because of the importance of it. We'll work towards that. We've got to keep community transmission low in order for that to happen. So if we can get more people vaccinated, that will certainly help reduce the risk.
Thank you. Our next question is for Louise. It comes from Stu from Bay Today. It has been reported private schools in Ontario will receive rapid antigen tests. Will local public schools have equitable access to the tests?
Thanks, Stu. I can't speak to the utilization of rapid antigen tests in private schools, but I am aware that there is some pilot testing being undertaken with respect to rapid antigen tests in schools. And the details of that pilot and the outcome of that pilot and how it will be rolled out to other schools is not yet known.
Thank you. Our next question is for Dr. Chirico. It comes from Michael Lee from the North Bay Nugget. On enforcement, will the health unit play any role in enforcing vaccine certificate systems announced by the province? Will that include fines or health unit orders?
That's a really good question, Michael, and unfortunately, we don't have the answers to that yet. We're still awaiting the legislation to be written up, and so we can look at the fine details, and that'll all be outlined in that, but currently we don't have that much detail to be able to determine. But yes, we do know that they're very likely, and there will be potential for fines. And we just have to await the details and the legislation to determine what the enforcement and who's going to be doing the enforcement.
Thank you. So that completes all submitted questions for this press conference. So we will conclude today's press conference. Thank you all for attending, and we will see you next week on Thursday at 10 a.m.
Thank you.